Without further ado, let's go on over to Wichita, Kansas, and Dr. Josh and Dr. Doug. Thank you very much, guys, with Atlas MD.
Thank you very much for having us. Please feel free to stop us and ask questions. We don't have video at this point, so just let us know verbally. But we'll start off with the general information of what we do and why we do it, go from there. But Dr. Doug and I founded Atlas MD about 3 years ago, September 2nd, 2010, with the idea that insurance complicates more things than it helps. The simplest of terms, health insurance or health care is expensive because of red tape. So he who cuts the most red tape wins. So we decided that we would do an insurance-free model so that we could cut out the middleman, and we felt that a membership model more accurately served our patient population because it offered the ability to do unlimited visits so that people weren't penalized for every visit they got. So that encouraged them to use as much care as possible as opposed to a copay model, which disincentivizes them to be healthy. We wanted to throw as much value as we could to our patients. So for a flat rate of $10 or $50 a month for kids or adults, we offer unlimited home visits, work visits, office visits, and technology visits like Skype, email, text messaging, Twitter, Facebook, etc. Because when we're not limited by how we bill insurance, then any way that we can communicate with patients improves our outcomes. To further increase the value, we again eliminated copays. We made it so that any procedure that we could do in the office was included complimentary. So that includes a wide list of things like EKGs, lacerations, biopsies, joint injections, ultrasounds, lung scans, bone scans, urine testing, pregnancy testing, strep throat testing, minor surgical procedures, cryotherapy, medical laser, etc. And then I think the most innovative thing we did outside of the insurance was to build a model that allows us to offer wholesale medications and labs. And I'll let Dr. Doug answer.
Yes, it's not like Penn and Teller. I actually do talk.
Yeah, too much.
One of the things that we realized too is that with the free market, once you're outside of insurance, you can do some fairly innovative things. So going directly to wholesalers to dispense medicines from our office. I know Kansas, along with many states, dispensing straight from the physician's office is allowed. And we can do that wholesale, essentially. We don't mark up our medicine. So what some medicines used to be very expensive, they're now quite inexpensive, even cheaper than on the $4 list at Walmart. So some of our patients actually end up saving more money or essentially making money every month by being a member, i.e. their medication costs less than their membership, the overall savings.
A good example of that is the day I was on with Hannity for his radio show in the debate. We had a 30-year-old uninsured woman. We saved her $75 a month on her medicines. Her membership costs $50. She's literally getting all the medicine she needs, unlimited access to a doctor, and she has $25 extra in her pocket.
So for her, going somewhere else means she'd lose $25 a month again in value, plus again all of the care. We do the same thing for lab work. We work with a local laboratory for a direct purchasing agreement. So we can do a cholesterol test normally charged out at $60 or $70. We get for free. Blood count, liver and kidney function testing, all of these things are significantly discounted for our patients.
So I know for you guys the big question is to expand Medicaid or not, and we like to just take a unique point on that. Regardless of what happens with this Medicare, Medicaid funding in the state of Michigan, I think there's a strong argument to be made to just spend whatever dollars you do have as wisely as possible. And the direct care model allows us to be several standard deviations more efficient. Again, you're cutting out red tape, which red tape is not adding value to patients. You're cutting out retail markup for medicines, for labs. You're eliminating copays, which means that lower income people can have, again, unlimited access to maximize their health opportunities. Procedures and diagnostic testing are also included. So you're doing everything you can to bring that cost as far down as possible. And we haven't really even talked about how this impacts the insurance companies beneficially. So.
Well, and that's something that we knew. If we could save you, $10, $15, $25 a month on your medicines, great. If I can save you several $100s a month, on insurance, strip away what excess you don't need. And I've mentioned it on many of the shows and interviews I've been on. If we had car insurance act like health insurance, then it would pay for your gas and oil and tires, and the insurance would tell you where you could shop for gas, how much you could get. You have to pre-approve a vacation or a trip out of town. It just wouldn't work. So we knew we had to model that in a way that's efficient. Anyway, the overall savings from that have worked incredibly. Actually, one company locally has worked with us with some self-funded ERISA type plans to actually count our membership towards the patient's deductibles. The money, the patient's money, is working twice as hard for them. And this is a huge step. Again, when most people are paying far too much, you can even look at when I was on with Governor Huckabee, Dr. Zwelling had her prices listed. A family of four is $7,400 per year. For us, a family of four is $1,400. You take that extra $6,000, turn it into insurance, an HSA account, a new car. You know, you can do some pretty amazing stuff.
And so direct primary care is concierge for the masses. You know, and the best part is it is maybe a cliche win-win-win. Employers win because they pay less. Employees win, or patients win because they get more value for their money. Doctors are happy because they don't have to work with insurance and actually make a little bit more than standard. But best of all, insurance companies win. And we need insurance companies on some level. I want life insurance, home insurance, auto insurance. But those models are designed like they should be. They're rarely used. But healthcare, we use it, $2.8 trillion system, pay a $20 copay to see the doctor. So this cuts out a lot of the risk to an insurance company. So when an insurance company isn't paying, or a government, Medicare, Medicaid dollars, isn't being spent on red tape and billing and coding and things that aren't adding value, but it's not paying retail for medicines, the value of unlimited visits, no copays, free procedures, wholesale pricing on medications and labs for up to a 95% savings, and then these patients don't go to the ER, they don't go to urgent care because they have their doctor's cell phone. Why would you go to urgent care and wait in line and pay money when you already have prepaid for your services and your doctor's waiting on you?
And something that was talked about earlier, that it's a point that I want to make sure we stress. Physicians, as soon as the Supreme Court came down with their decision for the Affordable Care Act, many physicians I know of, many colleagues, started calling their patients and saying they were going to close their doors. We are going to lose physicians and have lost physicians because of all this. We've actually had medical students email us and talk with us and visit, saying that we've reignited a dismissed interest in primary care. We've had physicians from all over the country come to our office and mention how this is something that will keep them not only sane, but actually keep them practicing medicine. We cannot afford to continue to lose physicians at the rate we are, and we absolutely need to find a way to get people interested in primary care, make it a specialty that people are interested in versus all of the subspecialties that people are.
The most common critique we get is it sounds maybe too good to be true.
Yeah.
We inherently understand healthcare to be expensive and cumbersome and bogged down with bureaucracy. 3 years ago, people said this wouldn't work. 2 years ago, they were surprised we're still open. Now they're starting to see that this has momentum and is a workable model that can be reproduced rapidly across the country and actually has a real opportunity to reverse the trend we're going in healthcare. Bring more doctors to family medicine, provide more care, be more cost-effective with their dollars, maybe even bring insurance premiums down to the point where they're affordable for the masses.
Well, and we challenge anyone with questions, naysayers, even people that like to play devil's advocate. We fully appreciate every one of those opinions and questions. By and large, everyone ends up having the same questions, but usually the same misconceptions. So we open up ourselves to either email, phone calls, any way people want to get a hold of us, please do so.
We're an open book.
All right, well, it's going to start right now here. So thank you very much, guys. And for their contact information, contact my office, and we'll get that out to y'all. But I want to start it off here.
I just want to verify. Can you hear this?
Can you guys
Yes.
hear?
Can you hear?
Yes.
Yeah.
Okay, I'm sorry. I just want to verify. You don't take insurance of any kind, Medicare or Medicaid, correct?
We don't bill or accept any insurance. We accept everybody regardless of their insurance status.
And the main reason for that is with as soon as you accept one, you're bogged down with all the same procedures, policies, mandates. That that's really what got this whole thing started. So
in for a penny, in for a pound.
Yeah.
Okay, I totally understand that. Where is there an exchange in your state, and how are you guys involved in that, if at all?
Kansas is not elected to run their own exchanges, so they'll be run by the federal government, if I understood the question right. Section 1301A3 of the Affordable Care Act discusses how direct primary care is a legal option in the exchanges. However, I don't think the best option will be to actually participate in the exchanges. Almost by definition, the exchange-based plans will be too expensive because of the bloat for bureaucracy. So I think mandate light bill that Kansas has and other states have will actually bring the cost of premiums down in combination with direct primary care. I think that's the better model.
Great, thank you.
Thank you.
Guys, anybody else?
Could you just ask them how many patients they can care for?
Yeah, well, first of all, Josh, how many physicians are in your practice for everybody here?
We have 3 physicians. We're the fastest growing practice like this in the country.
And how many patients do you serve with those 3 physicians?
We have 1,212 as of this morning.
Okay. All right. Another question here. Yeah. Any pushback from the federal government? Are they trying to knock you guys around?
None so far.
Okay.
So, and I think it's hard to push back against the model design to really be appropriately care for the masses. $10 for a kid is cheaper than the insurance. And so, free procedures, no co-pays. There's so much value in this that I think there's very little solid ground for someone to critique this model. It is a more cost-effective model, even if the states decide to pay the memberships or involve this in. Everyone's looking for ways to cut the cost of health.
For a quick example, I looked at data for just Kansas Medicaid, and in 1 year alone, on one dose, one medicine, usually used for either seizures or migraines, the cost paid by Kansas versus what it would have cost us to dispense it, the state would have saved $135,000 on one medicine alone. So if you look at this on a grand scale, you're talking about a significant impact on the state budget.
Yeah. And Josh, for the people here, can you remind them of your first client that you had? How much money did you save them? There was an employer, a small employer that you took on as your first client. Do you recall what figures you had there?
I'm sorry, could you repeat that?
Yeah, when I was talking to Josh early on, the first client that you had taken on was an employer, and the cost savings that you received for that employer and the rate of their invocation of the deductible was reduced to such an extreme amount. I just want you to kind of convey what that % reduction in their health care cost was for everybody in the audience.
Sure. Johnson's Garden Center, and they've allowed us to use this example. It's approximately 50 employees and family members total. They were looking at a 20% increase in their health insurance costs. They had cut pretty much everywhere else. They were looking at either letting employees go or no longer being able to offer insurance. They really were on the fence with that. We came in, reworked their insurance to a high deductible type plan, a better designed one, and the overall savings were about 55% less than what they were already paying. So you're looking at a 75% decrease. They paid half of their employees' $50 a month membership. So it dropped the savings down about 10%. So overall, still 45% savings. And over the last 3 years, we have about a total of an 80% reduction in their expenses. And interestingly, the first year the first 12 months that we took care of them, their rate only went up by the minimum rate increase, which essentially means they filed no claims to their insurance. So 50 people filed no claims, and we relocated, dislocated shoulders, did injections, school physicals, DOT physicals, etc. So it really does work on a company-wide scale, and we have more employers now with the same data.
That's the power of primary care and preventative care services, and I want to emphasize that. That's one employer. What if we actually created a market here in the state of Michigan where that was the norm? What do you think that would do from a job growth incentive perspective? What do you think that would do to, instead of turning healthcare costs into an impediment, which is what it is right now under the Affordable Care Act, what do you think that would do in regards to incentivizing people to hire people and stop forcing full-time employees to go to part-time? So this is very powerful beyond the context of the Medicaid expansion debate. That's why we talked about this as an overall healthcare system and not just an alternative to Medicaid expansion. So, hey, I know your time's tight there, Doug, and I thank you very much for your and Josh's time here. If you can stay online, you can have us on in the background or whatever, that would be great. But otherwise, we're going to move on to our next speaker here. But thank you guys very much for getting out and getting the good word out about direct primary care. If it wasn't for you guys, I wouldn't be plugged into this right now. So thanks for getting the word out.